Hi friends, after a long time I'm making a video. This is about tuberculosis. So I'm talking about tuberculosis. Tuberculosis is of two types: primary tuberculosis and secondary tuberculosis. Here I'm explaining about the pathogenesis. So when the bacteria enters into the lungs, it passes through the subpleural space and at a spot it'll stay. After that, it jumps into the alveoli and there will be an immune response and the release of macrophages will occur. When you see this in the microscope, you will see a battlefield where there will be a there will be a dead mycobacterium and also the macrophages which are released due to immune response, and there will be a cheesy appearance. Okay, and next now see macrophages pick up the bacteria from air sacs and moves to lymph nodes. Like from here, some of the mycobacterium, they will pick up the bacteria and move to mediastinum. So I'm going to focus about 2 points. What is gone focus and gone complex? Gone focus is granuloma present at subpleural space close to fissures called Ghon's focus. Where the bacteria is present is called Ghon's focus. The Ghon's complex is Ghon's focus plus lymph nodes. So after entering, the bacteria has three ways. Either it will be dead, the mycobacterium will be dead, or it may be in a dormant phase, or it will multiply a lot. When you see in a X-rays, the dead and dormant phase, we can't differentiate that much. But if you really focus, you will see a red live bacteria in the dormant phase, and this dormant phase is also called as latent tuberculosis infection. In the multiple chest, there is more number of mycobacterium, you will see a dead tissue in the X-rays. So if the dormant phase, we have talked about dormant phase, right? If the dormant phase, as the time passes, years goes on, the bacteria will reactivate, and the cavity in the upper lobe with full of tuberculosis bacteria and lots of diseased tissue around the cavity, which undergo progressive secondary infection. Secondary infection is nothing but, as we already have bacteria in our body, if the person the person is already having the primary infection, if some other person coughs, so the bacteria again enters into the body, and the bacteria which is sleeping inside will be reactivated by the bacteria which has entered from the other host. Okay. Now the other most important point is HIV patients are more prone to tuberculosis infection. It's the most important point to remember. Here the species which are causing tuberculosis are Mycobacterium tuberculosis, Mycobacterium hominis, Avium murine, Bovis africanum. So here I have made a thing like ham bar, so you can remember this while writing in the exam. Mode of transmission will be inhalation, ingestion, inoculation and transplacental route. Now we are going to talk about fate of primary tuberculosis, and this fate of tuberculosis is same also. It is same for secondary also. It may undergo fibrosis, calcification, ossification and progressive primary infection, and primary miliary tuberculosis. Primary miliary tuberculosis, that means the tuberculosis will enter the liver, spleen, kidney, brain, bone marrow. In secondary infection, the miliary secondary infection, it occurs to tonsils, pharynx, larynx, small intestine, skin. Remember this diagram so that you can remember. I have made like this because you have to remember. Next, the clinical features of primary tuberculosis. Here I am going to say about one story so that you can remember all the clinical features and write in your exam. See, One day my uncle called me in the afternoon stating that he had a temperature of 120 degrees and extreme tiredness, discomfort and weakness. So I told him to eat, but he said he don't want to eat, and he also stated that he has reduced his weight about of 2 kgs in 2 days. I told him to take rest. Next, again at night, he have called me at night and he said that my temperature is same as afternoon but reduced by night. But he said that he's getting sweat, cough which is full of blood stream sputum, chest pain, wheezing and chills. So I told to come to my clinic. When I clinically checked him, he has tracheal deviation and bronchial breath sounds which are very dull. So remember this story so that you can write all the symptoms. See here, I've already told you there is a weight loss, 2 kgs of weight loss. There is a fever that is same in the afternoon and evening. The temperature is same, but by night it has been reduced. I've told you that. And also told you night sweats, cough with blood, chest pain, wheezing, tracheal deviation. When we have came to my clinic, I've seen that there will be dull sounds. I've told you that also. Fine. Next, the main thing to remember is if the tuberculosis if it is involved of cervical and hilar nodes, it is called as scrofula. If it involves bones and joint, it is called as Pott's disease. If it involves skin, it is called lupus vulgaris. Fine with this? Now we are going to talk about oral manifestations of tuberculosis. Tuberculosis, primary of the patient is having primary infection. There you can see the tooth extruded from the socket. From the socket the tooth is extruded out, and the gingiva which is present